The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Do you hate the dentist? Well, if you do, you're not alone, according to my first guest. He is an expert on sedation dentistry. We've had him on the program before. He's got a lot to say. Dr. Atcha. Dr. Atcha, welcome to the program.
Nice to see you again, Randy.
All right. Now, sedation. You say this is a big part of your practice. I'm looking at a full-page ad here, and I said to you in the green room, I said, is this really that big of a deal? I mean, there's a lot of people that are that afraid of the dentist. And you said you love it. It's your favorite part of dentistry.
Randy, there's 145 million people avoid going to the dentist. They're what we call dental avoiders. Okay, they avoided going to the dentist because they've had bad experience. They've had either in the childhood or in their adulthood, and those people are the ones that I really like helping out. They're the most appreciative because they're able to come in where we're able to sedate them, put them to sleep, and they can get a very healthy mouth and a beautiful smile.
And this is IV sedation.
This is IV sedation.
So they're asleep.
They are asleep. They're absolutely asleep.
Do they wake up sometimes and say, are you done? Did you even do the procedure?
Sometimes towards the end of the procedure when they're coming out of their anesthesia, yes, they do wake up. But the best part about it is that they get their dental work done in 1 or 2 appointments, and they're healthy. They're healthy, so they can eat again. They have a beautiful smile, and they don't have to be miserable with painful teeth and ugly teeth.
Who's your typical patient?
Any typical patient is we target families. Okay. We target families. We have a large family practice with 3 other doctors. And
so there's 3 other doctors.
Absolutely. Okay. I have 3 other associate dentists in the practice. We target families. We target children. We target the parents. We target the grandparents. The whole community. We're in a family-oriented community.
So the procedures you do. I mean, you do everything. Right?
Yes, Randy.
I mean, you do root canals.
Absolutely. Absolutely. We do root canals. We do crowns. We do extractions. We do oral cancer screening. We have hygienists that do gum therapy, cleaning. So you
do cosmetic dentistry as well.
And we absolutely
dental implants.
And my passion in the practice is cosmetic dentistry, dental implants, and sedation.
Now, today's topic, big topic, sedation dentistry, oral sedation. It seems though that, going into this respectfully, that the oral pill seems safer. And you say that's not the case than IV sedation, because when I think of surgery, people don't like the whole IV thing.
Right. Well, think about it, Randy.
How is it different? I mean,
Think about it, Randy. If you go to a surgeon to have your tonsils removed, or if you're going to have a knee surgery done, are you going to be on a more comfortable level and a safer level versus a pill? So dentistry is no different. Oral sedation has limitations. I started out with oral sedation.
Like what?
Oral sedation has a limitation in the sense that it will only hit a certain type of patient. Somebody that is mildly to moderate anxious, somebody that has mild fear. With oral sedation, we can get them calm. We can get them to be relaxed, comfortable. And with nitrous, they'll do fine, but they'll be fully awake. They will be fully awake.
Okay.
You can talk to them. IV is the gold standard of sedation. IV is safer.
Are there studies that show that it's safer?
Absolutely. It's safest because you have an open IV line. I'm able to put a patient to sleep faster, and I'm able to wake them up faster. Okay? With oral sedation, it's a pill. I cannot reverse it.
That's a good point. Okay.
Yeah.
Okay.
With an IV, I'm able to give a wake-up drug, and we're able to we call reversal agents. We're able to wake them up immediately.
And you monitor them. I mean, you brought pictures of. So you're monitoring their heart rate, all of those things.
With oral sedation, there's not a lot of there's very minimum monitoring required. Okay. Now, when sedation is sedation, whether you do oral sedation or general sedation is sedation. In my philosophies, I like to do the most amount of monitoring as possible because my patient safety is number one. Okay. I can go into what we monitor. Let me show you this, Randy. This is a monitor. This monitors a lot of different things. Okay. Every monitor tells me a story. We monitor patients' oxygen. Okay. First of all, how much good air is coming in. Okay. Now, we also do what's called capnography, okay, which not a lot of dentists don't do, okay. That is how much bad air is coming out. Well, if you know how much bad air is coming out, you know they're taking good air in. Okay. I also monitor patients' heart activity, an EKG, how healthy their heart is conducting during the sedation process. We monitor their heart rate and rhythm, okay? And also we monitor the blood pressure. So if I know that somebody needs a little more medication, I can tell the blood pressure is going to be a little up. Well, I have an IV line open. I can give a little more medication. And here, they're going to be very, very comfortable. And they're actually, my patients, they don't talk to me. When they're sedated, they're sleeping.
But you still have to numb their mouth?
I still have to numb their mouth.
So the IV them, get them out, numb their mouth?
Yes,
Okay,
I still have to numb their mouth because for pain control. Because then when I do the dentistry, they're not feeling anything.
It's got to be easier for you, though, as a dentist,
Absolutely.
right?
Absolutely,
Because they're
Randy.
not moving.
They're not moving, they're sleeping, they're comfortable, and I'm able to get done a lot faster. And it's less stressful for the patient, it's less stressful for me, and less stressful for my staff.
Okay, you have a freebie that you're offering on this program. You're going to send them
Absolutely.
a pamphlet on what?
Absolutely. I've composed a consumer's guide to sedation and sleep dentistry. It just talks about what options a patient has. The patient is fear and they put off dental care. Well, they can read this and they can find out what different types of sedation out there that are available. So it's a very well-compiled information that I did for my patients, and it's available to the public, and all they have to do is call us, and we'll be happy to mail it.
I mean, I have dentists, oral surgeons that say, when they're doing dental implants, things like that, they say, I don't even tell people. I just do it on everybody.
Absolutely.
It's better on the patient, better on...
It's better for the patient. It's better for us as clinicians. And the kind of cases that I do, the patients that are what I call dentally disasters or train wrecks that haven't been to the dentist in 10, 15, 20 years, and they need to have their teeth removed and have implants put in. They're type A. They are not going to be sedated with a pill or nitrous.
How do you know? Do they act differently, by the way, when they come in? Do they call and they're afraid?
When they call, it all starts on the call. A lot of patients won't even call because they're so afraid.
Is that right?
It is absolutely right.
It's hard to believe. Do you think do these people feel like they're the only ones that feel this way? That afraid of the dentist?
Absolutely. They feel that it's unique to the situation. But my staff is they're very compassionate. They're trained. When somebody calls them, we just slow down and we just listen. Every patient tells a story on the phone. They tell us what has happened to them, how they've been hurt, they can't get numb, and the whole thing is that we tell them, you know what, Mr. So-and-so, you're not alone. We've helped many patients like yourself.
Is it true what you just said, though, that earlier, that some people, oral sedation doesn't work for them?
It doesn't work for them. It doesn't.
Is that right?
It's
like they just can't get numb?
Right. Here's the thing with oral sedation, Randy, is when you take a pill, it actually has to go through your stomach, through your digestion, through the hepatic, I call it, through the liver circulation. Then it goes to your brain and gets distributed to give you sedation. Well, it takes a long time. It takes 30.
But some people can't get sedated with oral sedation? You've run into it.
I've run into it where I've given them dose after dose, and they are wide awake. In fact, they're actually even more anxious. Okay.
And interesting.
And then realize that, you know what, this is not going to work for them. We need to take them to a different level, and this is where intravenous or IV sedation is going to come.
Okay, you think you say you're changing lives with
Yes.
sedation. You brought some photos, and
Absolutely.
and by the way, these are very graphic photos, but great afters. The befores are graphic. Okay, let's take a look. What are we looking at here?
Sure. Randy, I have this young man right here. This is his before. Okay?
Unbelievable.
Randy, this is a young man. This is a young man
boy.
in his late 20s. Okay, here's the story. He came to us, and he's getting married. Okay, he's getting married, and he came with his wife, and he said, "Doctor, I want a beautiful smile."
Is that rare though? I mean, that's a completely broken down.
There are people like him that are walking around, especially where I am, because they're. It's not like they're mad or anything. It's just they just don't smile because they don't know if there's any help available. Okay, he came in. His thing is he's getting married in a couple months, and he's going to Vegas with his friends for a bachelor party.
Okay,
and he wants to have his teeth done. He's one of the dental avoiders that I talked about earlier.
Dental avoiders.
Dental avoider.
Like really afraid of the dentist.
Really afraid
Wife
of the dentist.
had to drag him in?
Wife had to drag him in. Okay. Wife has really nice teeth. And he's in his 20s, so his motivator was pain. He's got pain on his top teeth and his bottom teeth.
Secondly, with those teeth, he couldn't really chew.
He couldn't really chew. Okay. And he was getting repeated infections. So I talked to him. We had a first appointment. He was so nervous that he actually had to be sedated to actually come in and talk to us.
Is that right?
So when he was in,
I don't mean to laugh, but it's really so hard for me to believe.
It is. Okay. It is so true that even for a first consultation, a lot of these people have to be sedated. When I say sedated, not through an IV, but maybe we'll give them a little of Valium before they come in. We'll prescribe some Valium, and they'll come in. They'll be more relaxed. They can talk a little better. And he's a very, very pleasant young man. He just told me his story that he couldn't get numb. Last couple of years ago, he had a wisdom tooth removed, and he just was not a good experience, and he just let himself go.
Okay, so what did you do? I mean, what are his options for those teeth right there?
His options were, the options that were given to him previously was dentures. And here's the thing, Randy. He's a gagger, okay? He can barely brush his teeth because he gags so much.
Okay.
He says, you know what? I do not want dentures. If you give me dentures, I'll never wear them. So we discussed what is the option for him. And the best option that we both talked about, and his wife is in consultation, we talked about getting dental implants. Okay, dental implants, and having his teeth removed, having dental implants placed, and having teeth put in the same day, and then eventually he'll get his permanent set of teeth. So we did for him what we call in our office a teeth in a day.
Teeth in a day.
And a full upper teeth in a day. And he had to be sedated for it, and we did full intravenous anesthesia sedation for him, and it was a very, very positive experience.
Let's take a look at that after.
Take a look at that. He's a very handsome young man. You can see what he looks like. This is actually the second day after his surgery.
So from that to that.
To that. And, he's very happy. He's smiling more.
He looks differently.
He looks different.
Really like a different guy.
Totally. And he told me that when he went to Vegas with his friends to his bachelor party, he had the time of his life. Okay, and he was smiling more. He's laughing more.
He's going to look better in the wedding pictures.
And he's going to look absolutely handsome for his wedding pictures. Look at the before.
Okay.
Beyond the cosmetics, the main benefits for my young patient here is he can chew better, he can eat better, no hot and cold sensitivity, no repeated infections, and
he can eat a steak, whatever.
And he can eat a steak. He can eat a steak. He can eat corn on the cob. He can eat whatever he wants, not what he was doing with his before. When you look at his before, he had severe pyorrhea or periodontal disease. So
his breath was bad?
Breath was very bad, and that's one of the things that his spouse was complaining, that he's got very bad breath. But now his periodontal disease is gone. He's got a cleaner mouth.
So once you extract the teeth, that infection goes away.
Yeah, all his upper teeth were gone, and the infection is gone. And his lower teeth we're keeping, but all the infection is gone because we cleaned him. We cleaned him up, and we did the deep scaling for him. So his gums are a lot healthier, and now he can chew and he can smile, and he doesn't have to worry about bad breath and repeated infection when he goes out in public.
And the only reason he didn't do it years before is just the fear of the dentist.
High fear, very high fear, and he didn't know that he could be put to sleep to have this done.
Interesting. Okay, so you have a few more photos.
Absolutely.
And we'll take a break. What are we looking over there? That's
okay. Randy, here's a before of a lady that didn't smile. That didn't smile for at least 15, 20 years.
Is that what they tell you?
This is what they told me. Let me tell you her story. She went to one of those denture clinic where she went for a consultation, and the only thing that they told her was that, you know what, you need to have your teeth removed and we can make dentures for her. And she did not want
like a chain dental.
Like a chain, yeah, exactly. And their focus is mostly take the teeth out and make dentures, and that's fine. It works for a lot of patients, but not for her. She's a very active patient. She loves going out. She loves to gamble. Okay.
What's going on with her teeth, by the way?
Her teeth.
So they had to go.
They had to go. This is the years of just pain. Again, another dental avoider because she's very, very high fear. She's afraid of the dentist.
Anxious.
Anxious. So her teeth had severe periodontal disease. Okay, they've had a lot of bone loss. They had to go, and she knew they had to go. Okay, and she was adamant she did not want dentures.
So what did you do?
Her thing was that if you can put me to sleep and get my dental work done, whatever it is, she's like, whether you can save my teeth, or take my teeth out and give me fixed teeth so I can chew. Do whatever you have to do. So for her, we discuss all the options. Your options are either dentures, implant dentures, or fixed teeth. And she decided, her husband was in, her husband, they both came in for the consult. He wanted the best for her. He said, make my wife look nice and beautiful.
Okay.
This is what she's been wanting for a long time. And we did for her what we call teeth in a day. Her upper and lower teeth, all her teeth were removed in one visit under sedation.
So she has fixed teeth now.
She has fixed teeth, full arch.
Interesting. And that's her.
And look at her after. I mean, she is a different person. She is smiling. She got her hair done, and she's much more social. She's smiling again. And every time she comes in, she hugs me, and she hugs my staff members, and she brings us Starbucks cappuccino every time she comes in because she's a big Starbucks fan.
So you feel like you changed her life. I mean, did she tell you that
absolutely
her husband? Because you say he was on the console. What does he say?
Her life has changed. From every time she comes in, she's much more happier. I remember the first time she came in, she was not happy. She was actually mad. She was actually a little skeptical. Like, what are you going to do for me? Nobody's really helped me. What are you going to do for me? And actually, her husband was very skeptical too. But after this patient, we actually she was a hard one. We actually had to meet several times.
So when she hears about IV, she goes in, she goes to sleep, wakes up, and she has teeth.
She wakes up and she has fake set of beautiful teeth.
Is that
top
right?
and bottom.
Is she emotional? Like when they look at themselves in the mirror.
When she woke
What
up,
happens?
When she woke up and when we gave her a mirror, okay, granted she was a little groggy, she was out of it. She actually cried. She actually cried because she was so happy that this is what before I went to put to sleep, I had teeth that didn't look good.
When you look at the before and after side
Absolutely.
by side, and she's looking at herself in the mirror.
She was ecstatic and she was very happy and she was crying. She said, you know what, this is a life-changing event. I mean, and not only that, as she came for her follow-up visits, I could just see her hair was done. She comes, she's lost weight. She hired a personal trainer to actually lose weight and get back on proper nutrition. She gave up smoking and her and her husband, they love to travel. They were putting off travel because she did not want to smile for pictures.
Interesting.
And they're very active in their community.
All because of sedation dentistry.
All because of sedation dentistry, and she was able to get her care done all in one day.
Okay, so there's a big difference. People just tuning in. We're talking about oral sedation. We're talking about IV sedation,
yes.
Not just taking a pill. Because you said the pill doesn't work for everybody.
Pill doesn't work for everybody.
And may be dangerous.
Absolutely.
For certain people.
For certain people.
Interesting, very interesting. We're going to take a quick break. We come back, more of these photos. And by the way, if you're just tuning in, we've got some, these are graphic photos coming up. The befores and then the afters are pretty good. So if you hate the dentist, Dr. Atcha says you're not alone. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Hot topic today. My guest here says that if you hate the dentist, you're not alone. Okay, some people actually say they hate the dentist.
Yes, they do.
So they haven't been, some people haven't been to the dentist in 10, 15 years?
10, 15, sometimes 20 years. And they say, Doc, nothing personal, but I hate the dentist. So, we laugh it out. We laugh it out. I said, why? Tell me more. There's always a story. It's nothing personal. It's just that they've been hurt. They've been hurt before. They couldn't get numb. They were told. This is what I hear. You can tough it out. Come on, a little more. No, you can't be feeling. You're numb.
Oh, so you mean other dentists will tell the patient,
yes,
you're okay, tough it out.
Absolutely.
Because they're not licensed to do.
But
I'm not trying to be too on your side here
Sure.
at all.
Sure.
I mean, this is a real interview. There's no scripts here.
Absolutely.
But oral sedation, IV sedation we're talking about.
Yes, IV sedation, the gold standard.
It's not expensive either.
And it's not expensive. It's not expensive because you know what? Think about it. Expense should not keep patients from getting a healthy mouth. The benefits of having sedation dentistry is, Randy, a beautiful smile. Okay, not only healthy teeth, healthy gums, but so they can chew and smile, but a healthy smile, because a beautiful smile is a window to your soul.
Of course, you're a dentist. You think the smile is important.
That is the most important thing.
Really?
That is the most important thing because, we say people notice your eyes, your ears, your nose, but no, the first thing that people notice is your smile.
Is your smile, okay.
A beautiful smile is very infectious. It is important for self-confidence. It is important for beauty. And with a beautiful smile, you're more approachable.
Okay, that's a good point.
A lot of these people, when they talk, they're covered their face. They don't smile. It's not that they're mean people or they're angry people. They're inside they just don't feel happy. People that have a beautiful smile are much more happier. They're more approachable.
All right. Now you wrote a book. I'm looking at this newspaper article, a guide to dental comfort and breakthroughs, and this is about sedation as well.
This is all about.
So my assumption is that all dentists are doing sedation. It's not. I mean, it's not the case.
145 million people in America avoid going to the dentist. That's 50% of the U.S. population. Okay, because they avoid going to the dentist because of the fear.
Is it a phobia? I mean, it's almost like a phobia, like when people are afraid of spiders or snakes.
It's a phobia. It's a phobia that stemmed in either early childhood or in their adult experience in the dentist. Now, sedation dentistry has come a long way. Majority of the dentists still will do nitrous. They'll give the laughing gas, and it's the most basic form of what we call inhalation anesthetic. It's good for certain people. Then,
but for complex cases, I mean, when somebody's mouth is a disaster, there's no way that'll work. Right?
even if it's for one tooth, then comes oral sedation. That works for mild to moderate fear. But to really get the patient to be in a really comfortable and a sleepy state, and a golden standard, which is safer and more effective, is intravenous or IV sedation. And only 2% of the dentists are actually trained. General dentists are actually trained.
Okay, so look for a dentist that does IV sedation.
Absolutely.
I mean, you could call and say, do you do IV sedation?
Call the office and say, do you do IV sedation?
All right. Now you have photos. And you say you're changing people. Oh, by the way, we should mention. So you're published. In Dental Town.
Yes.
This is a well-respected journal. So you write articles. I mean,
Yes,
you're a guy.
do.
I look at, and we didn't even go about your background training, but you have a very extensive resume or CV here. I mean, you're big on training. I mean, you're a fanatic about this.
I'm fanatic. I say dental school gave me a basic foundation of field of dentistry, but my training actually started after I graduated. So, and I've taken my training to a different level and a very advanced level. And I know the kind of people that I wanted to help that are not being helped elsewhere, and those are the fearful and the dentally disastrous patients.
So you attract the kind of patients.
Yes, I do.
That are
Absolutely. I attract.
But they say, and you say that they say you've probably never seen anything like this before.
I attract the patients that other dentists don't want to see, and I attract the patients that they say, doctor, I'm probably one of your most difficult cases. You've probably never seen anybody like this. They say that all the time.
Is that right?
Absolutely.
And what do you say?
And I say, you know what? You're not alone. We have helped many people like yourself.
Okay.
And I want you to feel comfortable.
All right. Well, let's take a look at this photo. What are we looking at?
Randy, look at this. This is a very, very attractive lady. Okay.
Okay.
And look at her. Here's her chief complaint. She wears a partial. And this is actually a very, very nice case that we published in the Dental Town magazine that you talked about.
Dental Town. Okay, that's your Bible.
That's
no, I'm kidding. Okay. Dentists read this, I guess. Okay. I tried to read it, by the way, and I couldn't take it after a few minutes.
It takes a certain kind to read it.
Okay, go ahead.
Anyway, her chief complaint was she wears a partial denture. The partial denture has metal hooks and clasps that comes in and out. And here, this is another dental avoider, okay? Dental avoider who hated going to the dentist because she did not like pain. She does not like pain, and she's a gagger. Again, a gagger. She wears a partial. She has teeth she has periodontal disease, meaning that she doesn't have a lot of good bone support around those teeth. The teeth are in very bad state of shape. They have decay and they have periodontal disease, and the partial is very ill-fitting. She does not want it. Her option, again, somebody.
So she hears about you because of sedation.
Because of sedation,
okay,
and because of dental implants.
Okay.
Because
you're the king of dental implants.
Well, we do a lot of dental implants.
Okay.
She does not want to wear denture. Okay, this was everything. She does not want to wear denture, and she wants a nice smile. And again, her husband came with her, very supportive. Okay. All she wants is a nice smile, so she can chew, she can smile again. She said that I haven't had a nice meal for the last 5 to 10 years since I've been wearing this partial.
All right.
And I asked her, I said, so tell me, what do you want to see different in yourself? She says, first of all, I want to be able to eat properly. I know I'm going to lose my teeth. I don't want to wear denture. What can you do for me? And we discussed what we can do for her, and we did implants for her. For her
dental implants.
Dental implants. All her upper teeth. She only has 7 or 8 upper teeth removed. We said, you know what? Let's say goodbye to your partial. We're going to give you fixed non-removable.
So it doesn't come in and out.
It does not.
No snap in, snap out.
No,
and they feel like their own teeth.
We did the.
It's painful though.
It's not painful, Randy.
Really, not even
It is not
afterwards?
painful because the pain is the bone doesn't have any pain. Okay.
All right.
The pain is the nerve ending, but with sedation, she is put to sleep.
She wakes up with teeth.
So
let's take a look at that after.
Look at that after. She is absolutely gorgeous now.
That's very nice.
Gorgeous. Her personality.
It's a very feminine smile, by the way.
Very
nice.
feminine smile. And a lot of thought goes into. It's one thing we're talking about sedation and sleep dentistry anesthesia, but a lot of thought goes into building her smile back. A smile design. We went through an extensive smile design, looking at her facial profile, looking at her eyes, looking at her nose. All the proportion, we call it the golden proportion, to give her the most beautiful feminine smile, so that way when she wakes up, she will have that. And not only she's happy, but her husband is just, he's like, you know what, I have my wife back. She's much more, she's much more outgoing, she smiles more, she laughs more. And it's a life-changing procedure for her, because when she comes in now, she has her hair done, she has her nail done, and she's much more happier. And
so they act differently.
They act differently, and she can eat what she wants. And this is all due to sedation dentistry and implant dentistry.
Okay, good. Now, we're just about out of time, but you have some more photos. We'll kind of sail through those. What are we looking at over there?
Okay, another patient came in, high fear, IV sedation, bad teeth had to be removed. Look at her after. Beautiful. She looks absolutely gorgeous.
Very nice.
Wakes up with a beautiful smile. She would not have gotten the dental work done because she's so high fear if it was not because of IV sedation.
Okay.
Here's another one. Patient in her 80s, okay? Bad teeth, had to go. Deathly afraid of the dentist, okay? Teeth had to be removed. Look at her after. She's smiling and she's loving it. She's more active.
Was she afraid though of IV sedation?
She was afraid of, because she was like, you know what? What's going to happen? Am I going to wake up? But you know what? We go through extensive evaluation.
It's not like regular surgery where you have a breathing tube down your mouth. I mean, this is light IV sedation.
This is light to moderate.
Okay.
When I take them on a moderate level, they're not talking to me. They're actually sleeping.
Okay.
So without the IV sedation, she would not have got this done.
So she heard about this IV sedation, and you work. So somebody in their 80s are candidates for this.
Absolutely.
Okay,
somebody
good.
in their 80s and somebody in their 90s. As long as they're in good medical history, we do a thorough medical history. We get a medical
And
clearance.
it's safer than the pill, you're saying.
And it's safer than a pill. We get a medical clearance from their physician, and you know what? Almost everybody is a candidate for IV sedation.
Okay, good. We have a few more. You're going to have to jam through these. These
Absolutely.
are good. Very good.
Another one.
Wow.
Another one. Bad teeth.
What is that?
It's another dental avoider. Bad teeth. A rampant decay on her teeth. Again.
So that's a regular photo?
This is a regular photo. Very high fear. Okay. Avoid going to the dentist. Look at her after. I mean, just her whole face comes out. Okay. Had all upper teeth done. Woke up to a beautiful smile.
All right. Now, when she sees that again, she looks in the mirror and
she looks in the mirror, and you know what? She is happy. She actually, every time we give a patient a mirror when they wake up with their beautiful teeth, they cry.
You know what's very, very interesting? That I guess this isn't for everybody, but if you don't like your smile, you could do something about it.
Dentistry has come a long way. Okay.
All right.
Dentistry is not how it used to be even 10, 15 years ago. Make an appointment. Learn about sedation dentistry. You're not alone. You can get this done.
Their consultations cost nothing, right?
Consultation costs nothing, and we, our thing is like we tell our patients, we take our dental avoiders or dental phobics and we convert them into dental missionaries.
Dental missionaries.
Dental missionaries.
Okay, what does that mean? So they're out now telling all their friends?
That means these patients are the ones that are that talk about you. These are the patients that are going to say this dentist changed my life, and these are the group of patients that are the most appreciative because nobody else have helped them, because nobody else can put them to sleep. You can, and get their dental work done.
So we're out of time. Final message. Somebody watching this, even though they've heard all of this, they're still afraid of the dentist. What do you say to them?
I say that don't let fear come in the way of having a beautiful and a healthy smile.
Okay.
Because they owe it to themselves. There's no excuse. Call us, make an appointment. The consultation is actually of no charge. First appointment, we're just going to sit and talk. Every patient we want to get to know. I want to know your story. What is your story? Tell me, how can I help you?
All right.
And you know what? Again, I will tell the patients, when you come to our office, if you became a dental phobic, you're going to become a dental missionary because we can help you.
So you could turn the dental phobic into somebody that likes going to the dentist, maybe?
Absolutely.
Really? And you see that?
I see that every day.
Okay, good. I want to thank you so much for coming on.
Thank you very much.
Interesting, very interesting. These photos are on your website as well?
Yes, they are.
Okay, good. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this again, or if you have a friend that says, I hate the dentist, and you want to see this again, go to our website at wellnesshour.com and just put in Dr. Atcha or Sedation Dentistry. You'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.